Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at the NYU Grossman School of Medicine. Every once in a while at my school, I get referrals about interesting or difficult clinical cases where doctors would like some input, some advice that they can consider in managing a patient. Sometimes those requests come from other hospitals to me, and I've been doing that kind of ethics consulting, both as a member of various ethics committees and sometimes individually when for various reasons doctors don't want to go to the ethics committee as a first stop. And in a very interesting case very recently involving a young woman I'm going to call Tinslee. She was 17 years old and she suffered sadly from recurrent metastatic osteogenic sarcoma. She had bone cancer. It had first been diagnosed for her at the age of 9. She had received chemotherapy and been under that treatment for a while. If it's treated, the osteosarcoma, before it spreads outside the area where it began, the 5-year survival rate for people like her is about 75%. But if the cancer spreads outside of the bones and gets into surrounding tissues, organs, or worse, gets into the lymph nodes and starts traveling around, the 5-year survival rate drops to about 60%. The two approaches are chemotherapy and amputation. That's sort of what we have to offer patients like Tinslee. So initially her chemo worked. She went to school. She enjoyed her sports. She was a real fan of softball and tried to manage the team and be involved in that area. She, at the time I learned about her, was planning to go to college. Her love of softball remained, but given the recurrence of the cancer, she had no chance to get anything with respect to her athletic interest, not just as a player, but as a manager, as someone who even might coach younger players. That was all off the table. She'd been very compliant up until this time with her chemo, but when the recommendation came in that she undergo it again, but now non-standard chemo because of the reoccurrence, experimental drugs using an experimental protocol, she said to her family and the doctors she didn't want to do it. She would rather die. She couldn't take any more chemo, and she certainly didn't want to do it if it was experimental, with the outcomes of this intervention being uncertain. Well, her dad said she can't decide. She's a minor. She's only 17. I want you to do and administer this novel form of chemotherapy and try to save her. Her mother was saying her input matters. I want to listen to her. Her mom wasn't as adamant about do it or don't do it, but she really felt that Tinslee should be heard loudly because she felt she was mature enough, old enough, even though a minor, to really have a position about what it is to undergo chemo. Well, time matters in trying to control the spread. The doctors were pushing for experimental intervention. And I should add, by the way, although it didn't really drive the decision about do it or don't do it, experimental care like this is not covered by most insurance, and it wasn't covered by their insurance. So they were facing a big bill if the experimental intervention was administered. There was some money in a grant to cover some of it, but they were going to face some big financial costs. It never came up in my discussions with the doctors about what to do. I'm not sure whether it ever came up with the family's discussion with the doctors about what to do, or even whether Tinslee was worrying that maybe she didn't want her family to face a financial burden. So I suggested that we bring the family in. We did some counseling. We had a social worker, family meeting, brought in a pastor because these people were fairly religious. And we talked about all scenarios, including accepting death, knowing that this disease was not likely to go into remission with the experimental effort. Maybe it would, but the doctors were not optimistic. And we tried to talk about how much we should listen to what this young woman wanted. We knew there was the possibility of going to court and having a judge decide this, but I, in my experience, do not like going to judges and courts because I know what they're going to say. They almost always say, administer the intervention. They don't want to be in a position of saying, don't do something. They're a little less willing to do that if something's experimental, but generally speaking, if you're headed to court, it's because you've decided that you want this to happen. And I felt, in all honesty, that this young woman should have some real respect of her position because the treatment was experimental. She is approaching the age of competency and consent, and she's been through a lot of interventions. She knows what's involved. I think you really have to listen hard to what she's saying. By the way, I also looked after this case. There have been some surveys of residents in pediatrics, and most of them say, excuse me, not most of them, a large number of them said that they hadn't received any training about what to do when mature minors refuse experimental treatments. The study I saw said 30% had not undergone any training about this, so we certainly want to introduce that into the appropriate areas of medicine that we talk about this with residents and fellows. But long story short, we had the family meeting, had another meeting with dad and mom in Tinslee, and the dad began to come around. He began to listen hard, and Tinslee said what she wanted was to go to her prom. She wanted to get to her sister's junior high school softball championship game, and if you will, setting some smaller goals that seemed to make her very, very happy, began to satisfy mom and dad that they could accept her refusal. So ultimately, an agreement was reached that she would not undergo the experimental intervention. We agreed on a course of palliative care, recommended that as what the doctors follow, and they decided to do so. And Tinslee sadly died. She died at home. She did make it to her prom. I think the outcome, while difficult, sad, and tragic, and a close call, was correct. Mature minors who have been through a rough life of interventions and know what the price to pay is for those who have a recurrent disease and now face only experimental options, I think if they say no, that's something we really have to listen to very, very hard. I'm Art Caplan at the Division of Medical Ethics at NYU Grossman School of Medicine. Thanks for watching.